I'd like to thank the committee for having me here. Yeah, luckily I'm old enough they didn't identify ADDH when I was a kid. But unfortunately I refused treatment, so I have like 2 or 3 jobs and always like to stay busy. I have no financial disclosures. I have no A or B conflicts. I'll do no off-label discussions. I want to talk about the different varies of immunological deficiencies, talk about some infections you may see, discuss CMV and EBV, and discuss some, if we have time, to get into some transplant-related things. Now, when you work in infectious disease, we always think like zebras, okay? And it drives hospitalists crazy, you know, because they cringe when they get the consult, because if they're putting in the orders, that means there's 20 things they have to look up that they've never heard of before. You know, can I have a histoplasma urine PCR and it has to be sent to Nome, Alaska by 3 p.m. today to get the test back? But the test won't be back for a week. So we'll figure out once the patient leaves in 2 days what we're going to do with it. But that's how we think a lot of times, just so you understand our background. Now, when you look at immunosuppression, it's a reduction in the activity of the immune system, which we know, and some portions actually have immunosuppressive effects on other parts of the immune system, so they'll actually attack themselves. And it can occur as an adverse reaction to certain conditions or even some treatments we do to patients. So we actually may immunosuppress them. In transplant, when I was there for 13 years, I loved immunosuppressants. I didn't like an immune system. Then when I came to ID, I realized I needed an immune system. And I was lucky enough, and if you ever get a meeting, one of my great mentors is Dr. Hiabana-Cloche. He worked at NIH, and he was an immunologist, and then he went to ID. And he just joined us at Mayo recently, so he's given us a great perspective of immunology that we really didn't have in the past. Now, when you look at the history of it, it's been around a while. And the first mentions were in plague in Athens, where these people noted that the individuals who got sick recovered, and then they were helping other people who were sick with the same disease. And the University of Maryland looked and concluded it was probably typhus. It's still debatable. But even when you think in the 18th century, a scientist, Dimorpus, worked with scorpion venom and found some mice and dogs were immune to the effects. And I kind of have to laugh that almost 200 years later, aren't we still playing with scorpion venom and cobra venom and looking how it can